Good afternoon, everyone. Thank you for joining us today, as usual. And let me start, as I always do, with the update on the COVID-19 statistics. An additional 16 positive cases were confirmed yesterday. That represents 0.4% of people who were newly tested yesterday, and it takes the total number of cases in Scotland to 18,500. It's worth highlighting that we have changed the reporting of figures on the Scottish Government's website from today, so that the figures for new cases, including that percentage of positive tests, are now shown more prominently on the main COVID page, and that website is updated at 2 o'clock every day. The Health Board breakdown of today's cases will be available at 2 o'clock, but the provisional information I have is that 4 of today's cases are in Lanarkshire. And more specifically, in relation to the outbreak at the CTEL call centre in Lanarkshire, I can confirm that as of this morning, there are a total of 24 positive cases associated with that outbreak, which is an increase of 4 since yesterday. And that includes 17 people employed at the site, which is 2 more than yesterday, and 7 contacts, which is also 2 more than yesterday. Now, given that the virus can have a long incubation period, intensive work is still ongoing in order to ensure that all possible chains of transmission from this outbreak are being closed down, and I'm very grateful to everyone who is working very hard as part of that effort. I can also report today that a total of 287 patients confirmed as having the virus are currently in hospital, which is 8 fewer than yesterday. And as of last night, there were just 2 people with confirmed COVID in intensive care in Scotland, which is 1 fewer than yesterday. And finally, on the statistics, I am very glad to say that once again, during the past 24 hours, no deaths were registered of patients confirmed through a test as having the virus. The total number of deaths under this measure, therefore, remains 2,491. This is obviously very welcome news. It means that no deaths have been reported in Scotland under this measurement during the entirety of the past week, and that just 1 death in Scotland has been reported over the past 15 days. Now, it's exactly 4 months today since the country went into lockdown, so there's no doubt that these figures show the incredible progress that has been made in that time. But that progress has not been hard. It has been hard won, and it has been a very painful journey over these past 4 months, in particular for those who have lost someone to this virus. The number of deaths is still a reminder of the impact of the virus, and therefore I want to extend my condolences again today to everyone who is grieving somebody that they loved. In addition, I want to thank again our health and care workers for all of the work that you continue to do through this really challenging time for everyone. Now, I have one issue, one very important issue I want to talk about today, which is changes in our advice to people who are shielding. It's now almost 4 months since we asked those considered to be at the greatest risk from this virus to shield. At that time, there was a very high risk that you might be exposed to the virus, and therefore shielding was necessary to keep you safe. Together with local government and the third sector, we've been able to put in place support for you while you have been shielding, for example, access to free food deliveries if necessary. But I know that shielding has been incredibly difficult. It has separated you from your family and loved ones. It has restricted you in virtually every aspect of your normal lives. And there are very obvious and very real potential harms to your mental health from extended isolation. For all of these reasons, we've always been clear that we won't ask you to shield longer than you have to. The infection rate now is much lower than it was in March, and just to give some illustration of that, when the shielding advice started, more than 20% of COVID tests were proving positive, and 150 new cases a day were being reported. Less than a week after shielding started, we were reporting more than 300 new cases a day. Today, of course, I've reported 16 new cases, and that is 0.4% of people testing newly positive. So as these figures today show, we are now in a very different position to the one that we faced back in March. And as a result, and as we have previously indicated, some further key changes to our advice will take effect from tomorrow for people who are shielding. Now, the information I'm about to give you, I know, can be perhaps a bit difficult to follow as I am saying it. So all of the changes that I'm about to mention are listed in our route map for shielders, which you can find on the Scottish Government's website. But from tomorrow, you will, if you're shielding, be able to meet indoors with up to 8 people from up to 2 other households, as long as physical distancing is in place. You will also be able to meet outdoors in groups of up to 15 people from a maximum of 4 other households. You can also use public transport, including taxis, while wearing a face covering. You can go to outdoor spaces in pubs and restaurants. You can go to indoor shops, pharmacies and indoor markets. You can attend hairdressers and barbers, and you can visit museums, galleries, libraries and cinemas. And children who live with someone who is shielding can attend formal childcare providers. Now, all of these changes that I've just mentioned, which you can find more detail on the website, these will take effect from tomorrow. But our clinical advisors, who have been closely examining all of the evidence, have also advised us that as things stand right now, assuming no significant deterioration in the position, as things stand right now, we will be able to pause the shielding advice altogether from the 1st of August. From that day, the advice for people shielding will then be the same as for those who are simply at heightened risk from COVID, older people, people who received the flu jab because of a health condition, and people who are pregnant. So this means that from the end of next week, you will be advised to follow the guidance for the general population, although we will ask you to be especially careful about hand hygiene and physical distancing. And that will also mean that children who have been shielding will be able to return to school in August. And if you have been staying away from your workplace because you've been shielding, you will also be able to return. However, your employer must ensure that you can do so safely. And of course, our advice, not simply for shielding people, but for everyone, remains very strongly that you should continue to work from home whenever that is possible. Now, I know these changes will be welcome to many of you, but they will also, for many of you, create a great deal of anxiety because you have been living in such a restricted way for so long, and you will worry about going back to normal. That is completely understandable. So we are not asking you to stop being careful, and we do not want you to feel under pressure to do anything that you think is unsafe. In fact, we want to do everything we can to help you to feel as safe as possible. Last month, I indicated that we were looking to develop a range of information and tools to help each of you to make informed decisions about how to stay safe. We're providing a range of advice on returning to employment and schools. The guidance for schools will be published on the 30th of July. For those of you in employment, we have developed a risk assessment tool that will be available from Monday. It will help your employer understand the adjustments they need to make to help you feel safe. We're also providing information on what activities are safer or less risky than others and how to undertake them safely. We've developed advice on risk factors and practical information on how to stay safe during everyday activities like going to the shops, visiting friends and family, or using public transport. You also told us in feedback that you would find it helpful to know what the infection rates are at any given time in your local areas. So we are developing a COVID forecasting service for people who have been shielding. And that will allow you to sign up to an SMS update that tells you about your risk of being exposed to COVID in your local area. And although the food box scheme is ending, you will continue to access priority supermarket delivery slots if you need them. And if you have registered for this service by the end of this month, and you will also still be able to go to your local authority for support for food provision. And we will be keeping open our shielding SMS text messaging service and our national helpline. Finally, we're continuing our work to keep you safe after August the 1st. We're strengthening the evidence base about who may need to shield again in the future should we see a resurgence of the virus. We're continuing our surveys and research to understand your experiences and to offer support that has value to you. And we will set out the kind of steps we might need to take should there be a spike of infections in the future. We're changing our guidance now because the infection rate is low now. But we will continue to monitor this, and if things take a significant turn for the worse, whether nationally or in your local area, we will take the steps we need in order to keep you as safe as possible. In particular, we will contact you and we will give you clear advice on what to do if we are asking you to do anything different. Before I end, I want to thank everyone who has been shielding. You've had to remain in your house and largely apart from all other people, even people in your own household, for months now. That has been incredibly tough, and it's easy for me to say that when the reality is I actually find it hard to fully imagine just how difficult that must have been. But by doing so, you have protected yourselves, you've reassured your loved ones, and you've helped our health and care services. So a sincere and heartfelt thank you from me to each of you for that. And I also want to say a few words to people who are not shielding. Many of you have been actively involved in support for people who have been shielding, whether that is as family, friends, carers, volunteers, council workers, delivery drivers, health and social care professionals, supermarkets, wholesalers, and a whole host of other people. So my thanks to all of you for that too. And secondly, if you're an employer or a school, we need you to work closely with people who have been shielding in order to take the necessary steps to keep them safe, but also to assure them that you will keep them safe. Please do that. Reach out to people who have been shielding to understand their needs and provide that help. And for all of us, we should understand the worries and concerns of people who have been shielding. Many people who are shielding will still be nervous about returning to work or returning to shops and restaurants or socialising a bit more. All of us should understand that and be as supportive as we can be. And finally, this is my final point, shielding and shielding people demonstrate again, and perhaps more powerfully than anything does, just how all of us are dependent right now on each other's actions. The reason that we can pause shielding, hopefully at the end of next week, is because all of us have stuck to the guidance so far. All of us need to continue to do that in order that we continue collectively to protect those most at risk. And that basic idea that all of us, more than ever, are depending on each other is the note that I will end on. We can only reopen services, start to reopen the economy again because infection rates are low, and we will only be able to keep all these things open if infection rates stay low. The virus, as we know, is still out there. It is still highly infectious and it is still highly dangerous. So all of us have a part to play in keeping it under control. So let me end with the usual advice that I'm going to continue to say as often as I need to in order that everybody understands that if we all stick to this, we can keep this virus under control. So that is the facts, message, face coverings in shops, public transport or any enclosed place where physical distancing is difficult. Avoid crowded places, whether they're indoors or outdoors. Clean your hands and clean hard surfaces regularly. 2-metre distancing, that remains the important advice, and self-isolate and book a test if you have any symptoms. If we all follow this advice rigorously and rigidly, then the progress we have made over these past painful 4 months will be progress that we can continue to see. So my thanks to all of you for doing that. In particular today, my thanks to all of you who have been shielding. Now, that was a slightly lengthier than normal update. We will go shortly to questions, but first I'm going to ask the Economy Secretary to say a few words, and then the Chief Nursing Officer will conclude, and then we will take questions from journalists. Fiona.
Thank you, First Minister. As we move through the different stages of the route map and the economy continues to open in a safe and orderly manner, we're seeing activity and demand returning to key parts of the economy that have been closed. Last week, we saw a range of economic data relating to the lockdown period in Scotland, which confirmed the extent of the impact. But it also hinted that the recovery in output has begun, and as we see more activity, the economy will continue to strengthen gradually. So now more than ever, it is vital that we support people and businesses as we recover from the economic impacts of the coronavirus pandemic. And this is especially true of our local and rural communities. And that is why today I am pleased to announce that more than £2.1 million has been awarded to tourism, business, community and agricultural projects across Dumfries and Galloway and the Scottish borders to support economic development across the region. We're committed to developing the south of Scotland's economy to its full potential, And in total, 28 projects will benefit from the Scottish Government funding through the South of Scotland Economic Partnership, supporting the region's economic recovery from the coronavirus crisis and helping to generate future job opportunities. Among the projects to receive funding are a programme to celebrate the 250th anniversary of Sir Walter Scott's birth, stimulating tourism across the area, a programme to help young people with autistic spectrum disorder build their skills and find job opportunities, and a project to develop livestock holding facilities enabling farmers to collaborate to reduce transportation costs, and a new business incubator to support small and micro businesses. Now, these investments will create jobs, support businesses, develop skills, boost tourism and contribute to town centre regeneration. And many of the projects will help key industries in the region, which have been hit hard by the pandemic as they work to recover and grow. Others will develop local supply chains, skills and employment opportunities to help drive local and regional economies forward. We have also today announced that the Outer Hebrides, Orkney and Shetland will benefit from investment of up to £50 million by the Scottish Government as part of the Islands Growth Deal. A range of areas, including tourism, infrastructure, innovation, energy transition and skills, will be targeted with the funding, and it will be invested over 10 years and will support local sustainable economic recovery and growth. And as we safely move out of lockdown, it is vital that we look to the future to recover and renew our economy. Our response to the Advisory Group on Economic Recovery report and the Enterprise and Skills Strategic Board report will be an important step to reshaping our economy for future growth. We are making good progress with both of these, and the alignment between the two is very clear. I can now confirm that we will respond to both of these reports together in the first week of August. Finally, today I want to touch on the importance of home working. Home working as a public health measure has been a crucial factor in mitigating the transmission of the virus among the general population, and as such is currently the default position. Those who are working from home are contributing to the public health effort, just as those returning to the workplace are. In fact, people working from home are making it safer for those workers who cannot work from home. So it is an effort we absolutely must continue. We are publishing guidance on home working today to support employers to continue home working and allow everyone who can work at home to do so. It's vitally important as we continue to reopen more and more businesses that we all do everything that we can to keep the virus suppressed so that we can keep moving forward and making progress.
Thanks, Fiona. And Chief Nursing Officer.
The First Minister talked about the move we're making on removing restrictions for people who are shielded because of their vulnerabilities of their health status. I wanted to say a few words about another vulnerable group of people, and that is residents in care homes. And we have, on the 3rd of July, we lifted restrictions, and with much joy and laughter across the country, residents in care homes were supported to have one visitor with outside visiting. And I know how much that's meant to families, to the residents themselves, and also to the care home staff who have done an amazing job supporting both families remotely, but also the residents within the care homes to manage through this pandemic and to manage through lockdown and having no visitors. We're working with Scottish Care and with the care home sector themselves, along with other professional advisory bodies, clinicians and others, to make sure that we then take the next step of supporting indoor visiting by one person, but also outdoor visiting by more than one, by having 3 outdoor visitors for residents. And I know that that is longed for within the care home sector. We are working hard to do that, but at the moment, what we are saying, we want time to make sure that our care home residents are safe and therefore are continuing with our current visiting arrangements, which is 1 outdoor visitor per care home resident. as soon as we can, and we're actively working on looking at when we can change the arrangements for visiting, we will do that, because we know how important it is to care home residents and their loved ones. And we also know that care homes are people's homes. But first and foremost, we also know how vulnerable the care home residents are to COVID, and therefore their safety is at the forefront of the guidance that we're giving to make sure that we keep them as safe as we possibly can. So in the coming days and weeks, we will be actively looking at how we can remove some of the restrictions to make life more normal for people within the care home setting. But at the moment, we're sticking with our current guidance to make sure our care home residents are safe.
Many thanks, Fiona. We'll go now straight to questions. Katie Hunter from BBC Scotland.
Afternoon, everyone. First Minister, you said yesterday, and I'm paraphrasing, that you were a bit more hopeful yesterday than you had been the day before that the test and protect system was doing what it should be doing in Lanarkshire. I'm just wondering if that's still the case. And just one other quick question, if I may, on the economy. We're doing a report on Funfairs tonight. I think they were originally told they could expect to open on the 15th. That advice was then changed and now they can't operate. I'm just wondering if you can tell us why that advice was changed and if they can expect to operate this year at all.
I hand over to the Economy Secretary on the issue of Funfairs. I think they were given some inaccurate information, which we apologise for, but Fiona will say more about that. On your first question about my confidence in Test and Protect, it does remain the case that, as I said yesterday, my confidence in Test and Protect, not just in Lanarkshire, but actually more generally, it grows with every day that passes right now. And I'm hugely grateful to the very many people across the country who are taking part in that effort. The people who are contact tracing, giving the advice, working in our public health teams to understand the chains of transmission and try to break those. It's an enormous effort. So my confidence in that is high and increasing, but I'm not complacent. And I'm not complacent in Lanarkshire. As I said earlier on, this is a virus that we know has quite a lengthy incubation period. So although we look at the numbers now and can take a degree of assurance that it appears to be under control, in a couple of days it is not impossible that will look different. So I think we have to be cautious and continue to focus on the work that has to be done to contain and suppress that particular outbreak. And more generally, we have, since lockdown started to ease, we've had an outbreak in Dumfries and Galloway, which was very well handled by the local teams there, and we're now dealing with one in Lanarkshire, which is being very well handled by the teams there. But obviously we may see more of these outbreaks, and every time we see one, particularly if we have a scenario in the weeks to come where we might be dealing with more than one at a time, then we want to assure ourselves that Test and Protect will still work as I expect it will do in that way. So my confidence is growing, but I'm in no aspect of handling this crisis am I ever going to allow any complacency to creep into it, because we know that the thing we know, possibly the only thing we know with absolute certainty right now, is that COVID is still out there. It is still very infectious and it's still very dangerous to people who get it. So those are the fixed things, and we must make sure we stay on our toes to do everything we can to keep it under control, because the cost and the pain of allowing it to get out of control again would be too significant. Fiona, do you want to say a bit more about Funfairs?
We will move to reopen Scotland's Funfairs when it's safe to do so. Unfortunately, there had been conflicting advice issued. The regulations are quite clear about a specific reference to Funfairs, and they're not able to open at this stage. Previously, I think there was a conflict of advice that they may have been considered as visitor attractions, but clearly the regulations state that there is a definition for Funfairs. We will work with the Showman's Guild, a very important part of that industry, and we will work with individual Funfairs as well. It's important that they can reopen when it's safe to do so, and we will certainly try and make sure that we can work with it in a constructive way. And it is unfortunate and regrettable that conflicting advice previously had been issued.
Gordon Cree from STV.
Thank you. Boris Johnson has said that the response, particularly economically, to the pandemic has shown the strength and might of the union. We can probably take it as read that you don't agree with that. But for those of us who don't have the luxury of being behind the scenes and seeing what was on, how have the two governments been working together? And if I can ask Fiona Hyslop, just picking up on the issue of Funfairs, a question from our colleagues in Aberdeen, specifically about Codona's amusement park. There are 180 jobs or so at risk there. They say they have been wrongly categorised alongside travelling Funfairs and are calling for an urgent review. What can you do for them?
I'll hand over to Fiona in a second. On the question about the Prime Minister's visit today, look, this is a COVID briefing. People of all political persuasions and none watch this briefing to get information, and I want to make sure that it doesn't get pulled into the political arena. Apart from that, my focus is not on political campaigning right now. As I think you've seen every day for the past few months, it's on dealing with an ongoing, very serious situation. So I'll limit my comments here to the COVID aspects of this. I've tried very hard and will continue to work very hard to have a very collaborative approach with the other governments of the UK. That's not just the UK government, but the Welsh government and the Northern Irish government, because I think that is in all of our interests. But I will also be very assertive in the right of the Scottish Government, where we consider, not for political or constitutional considerations, but for public health considerations, our ability to take our own decisions if that is in Scotland's best interests. On some of the points around the support through COVID that the Prime Minister has been, I understand, making today, on the financial support, that's been very welcome, and Fiona and I and others have welcomed it repeatedly. But let's be clear, this is borrowed money, and the reason it is coming to the Scottish Government from the UK Government is that the UK Government holds the borrowing powers that Scotland doesn't hold. Scottish taxpayers will pay the cost of that borrowing just in the same way as taxpayers across the UK Government will. So it's not some kind of favour that's been done for Scotland. And if the Scottish Government held the borrowing powers, we would be able to provide that support directly, and perhaps we would be able to have greater flexibility in how we design these schemes, just as where we do have autonomous decision making, for example, in the decisions we're making to come out of lockdown, we are designing those decisions in a way that best meets Scotland's needs and circumstances. And I suppose my only final point on this would be, I don't think any of us, and I include myself in this, should be trying to use COVID and the pandemic and the crisis situation we have faced and continue to face as some kind of political campaigning tool. This is a pandemic that has taken the lives of more than 50,000 people across the UK. We've all tried to do our best, but I don't think any of us have got any grounds to crow or to feel satisfied about this. It's not politics, it's not constitutional arguments. Every leader of every country right now has a real duty to remain focused on doing everything we can to tackle this and not use it as some kind of political weapon. So I'll continue to focus as hard as I can on the job in front of me, and I'm sure the Prime Minister is well able to speak for himself. Fiona.
Yes, as the First Minister has said, that state governments across the world can use their powers to borrow. And to give you an indication of what that means for the UK government, the public sector net debt rose to £1.98 trillion, or 99.6% of GDP in June 2020. And that's the highest debt to GDP ratio since 1961. The OBR has also indicated that the UK's fiscal deficit is likely to reach between 15 to 23% of GDP in 2021. Now, to give you an idea, that's depending on the speed of economic recovery, that's the highest peacetime level in 300 years. So countries across the world are dealing with debt in order to tackle business issues. Just very briefly, I can say that I have regular discussions with the UK government, productive and constructive. I have discussions with my Welsh and Northern Irish counterparts, with Nadeem Zahawi on a weekly or fortnightly basis. I also speak regularly to Alex Sharma, the Secretary of State. So currently we're looking to try and influence UK government's economic recovery in relation to energy. We hold certain powers, they hold certain powers. If we really want to unlock a green recovery, we need the UK to use its powers in relation to transmission and regulations in particular. So that's a very practical example of what we need to do, because our priority is economic recovery, our priority priority is jobs. And that brings me to the point about Cadonas. Cadonas is a really important and well-respected business in Aberdeen. There are a large number of jobs, as has been mentioned, dependent on them. There has been conflicting advice given generally, and that has to be addressed. And certainly we're sorry for any confusion that has been sent, particularly to Cadonas. We are of today making sure that Cadonas are having contact with the Scottish Government so that we can work with them to make sure, as I've answered previously, we can get to a situation that Funfairs, which are distinctly referenced in the regulations, can be opened and opened safely.
Gerard Tubb from Sky. Do we have Sky? Okay, if we don't have Sky just now, I will, if they appear back on the line, I'll come back to them, but I'm going to move now to Tom Sheldrick from ITV Border.
Thank you, First Minister. Picking up slightly on a previous question and response, but a report published today by the House of Commons Scottish Affairs Committee has said that communication and cooperation between the UK and Scottish governments was very strong during the early stages of the pandemic, but has worsened significantly more recently, and that's led, they say, to some confusion. From your point of view, why has this happened? And do you think it has actually had a negative impact in terms of the response to the coronavirus crisis?
Well, I'm responsible for Scotland's response, and I don't think anybody watching these briefings day after day would ever, I hope, would never form the impression that in any way I am complacent or think that it's job done or think that there are not things we've got to reflect on about our past handling. I remain very focused on getting the country as safely as I can through what is the biggest crisis any of us have faced. But I do know that Scotland, as of now, and this is where my refusal to be complacent is most important, because these things, as we see in some other countries, can change very quickly. But as of now, Scotland has a very low prevalence of this virus. We have, in terms of confirmed positive patients, we have had no deaths over the past week. We've had only one in the past 15 days. And that is a much lower position in terms of the state of the virus than other parts of the UK. And therefore, that says to me that what we're doing in Scotland is right, and we should keep doing it and make sure that we don't take our eye off the ball or drop our guard. There are discussions when it is appropriate and necessary with other governments of the UK, and I try to be a constructive participant in those. I'm due to speak with Welsh and Northern Irish counterparts, I think with Michael Gove tomorrow. I have discussions regularly with Mark Drakeford, the First Minister of Wales. Similarly with Northern Ireland, we have regular discussions. So I think those relationships are good, but we have, all of us, our own responsibilities, and all of us have judgments to make about the right decisions for our own countries. And that's the responsibility that I take very seriously in respect of Scotland. Some of the frameworks for decision making, like the COBRA forum, for example, I can't call a COBRA meeting. It's only the UK government that can do that. There hasn't been a COBRA meeting since, I'm not sure I'm getting the date right here, but I think the early part of May. I think it might be better if we had that forum able to discuss things a bit more often, but that's not my decision. So I will continue to be as constructive as I can in how we take forward the things where collaboration and cooperation is important. But my primary responsibility is to take the right decisions or the best decisions I can take for Scotland. And my primary responsibility is to do that in a very straightforward way and not be influenced by politics or constitutional arguments. And that's what I've tried to do. And some people, might be happy with that. Other people might be frustrated with that. But I take that responsibility to steer this country as safely as I can through this crisis. As I think I've said before, probably more seriously than I've taken anything in my political career. And I'm going to continue to do that to the best of my ability for as long as it takes. And Kieran Jenkins from Channel 4.
I know you want to limit your comments to the coronavirus response, but the Prime Minister has been talking directly about the pandemic response, and he has said that it has shown the sheer might of the union in Scotland. Do you think he has a point?
Look, no, I don't, and for a couple of reasons. As I've said, some of the things I think he references are simply a feature of where power lies. If Scotland was an independent country, then just like Ireland or many of the other small countries, we'd be doing these things ourselves. So in that sense, I think it's a bit of a redundant argument. On a more fundamental level, I just don't think any of us should be championing and celebrating a pandemic that has taken thousands of lives as some, example of the pre-existing political case we want to make. This has been a heartbreaking crisis that we're not out of yet, that too many people have died, and all of us have a really, really solemn responsibility to focus on and to get our countries through. And that's what I'm going to continue to do, taking the decisions I think are best for Scotland in all of the circumstances we face. Campaigning right now is not my priority. Boris Johnson has every right to be on a campaign visit to Scotland today. In his shoes, it's not how I would be choosing to spend my time, given what we are facing right now. And people can make up their own minds about these things, and can make up their own minds about where they think the decisions that we're having to take right now are best taken. But none of us should be crowing about this pandemic in a political sense, is my honest opinion. Fraser Knight from Global.
Thank you, First Minister. Boris Johnson isn't meeting you today, so if you just don't mind clarifying for us, you said the last COBRA meeting was the early part of May. Have you spoken to him at all since then? And also, if I may, soft plays are among some of the businesses which still can't reopen in Scotland. The managing director of Wonderworld Soft Play, they own a number of premises in Scotland, says it's nonsensical because he's not seen any evidence to understand why they can't open when children don't have to social distance. So I was just wondering if you can tell us why it is that they're not allowed to open just yet.
I'll come on to that question in a second. Look, I don't want to sort of focus too much on Boris Johnson's visit today. He can say why he's here and why he's doing certain things and not other things. I would have met with Boris Johnson had he asked me to, had he come to Edinburgh to meet. I have spoken to him since the last COBRA meeting. I think from memory of, if there's been a more recent occasion, then I will correct this later, but I think from memory the last time I spoke to Boris Johnson was on the day of the dreadful knife attack in Glasgow, when he very graciously called with his sympathies for what had happened then. So I've had conversations with him on the phone, and we will continue to speak when necessary. But I've got a job to do. He's got a job to do as well. I'm focusing on the job I've got to do. We are thankfully in a better position with this virus than we've been for 4 months, but we take our eye off the ball of this at our peril. And I'm very mindful of that every day, that if I get dragged on to other issues and focus on issues, I'm a politician. Of course, I enjoy political debate and I enjoy political sparring, and I look forward to getting back to that because it will mean this crisis is under control. But right now, it would be a dereliction of my responsibility to take my eye off the coronavirus ball, because that's the point at which we risk it going backwards. So I'm just going to go on with my job and let the Prime Minister speak for himself. And on the soft play issue, we look at these things very carefully on an ongoing basis. I take no pleasure at all in any business right now that can't open yet. I want to see businesses able to open, get back to trading and making money as quickly as possible. But we can't do everything at the same time. We have to be very mindful of the different environments that people are operating in. And we've got to limit the changes we are making at any one time. And I said yesterday that over the next few weeks, having made big changes in recent weeks, over the next few weeks, our absolute priorities are pausing shielding if we can, and I've given an update on that today, but getting children back to school full time. And that is good for children, but that is also going to be very good for the economy. So sometimes we just have to make difficult judgments about what can and can't be done, and that will continue to be the case, and we will make them in the best way that we possibly can, but absolutely understanding the difficult position that many businesses continue to be in.
Fraser Nichol from Original 106. Thank you, First Minister. Good afternoon. Sort of linking on to that, we've been speaking to management at P&J Live in Aberdeen, who are looking for some clarity over when events might be able to return there. Now, venues in England have been given a provisional date of the 1st of October for the resumption of business events and conferences, and business leaders here claim venues like P&J Live are being put at a competitive disadvantage. Can you give them an idea of provisional dates so that they can start planning for their reopening? And what are the reasons you're not matching England in allowing the return of conferences where bosses say physical distancing can be maintained?
I can't give that date right now. I will give these dates to businesses that, as of now, are not able to operate as normal as quickly as possible. But I have to make these decisions in a very careful and balanced way. I said our priority over the next few weeks is getting schools back and shielding people their lives back again. And that means we may have to take slightly longer in doing some other things, but we will continue to make these decisions carefully. And in terms of matching England, we're not matching England right now when it comes to levels of the virus. We've got lower prevalence, we've got fewer cases every day, and thankfully we have fewer deaths. And that is the most important thing right now, not just in terms of health and life, which for all of us is the most important thing of all, but that's the most important thing in terms of the sustainability of an economic recovery. If we go too quickly, and I know there are many people out there who would like us to go quicker, and I absolutely understand, none of this is straightforward or easy, and none of it is desirable. But if we go too quickly and the virus starts to increase again, we put that economic recovery at risk, and we end up going backwards instead of forwards. And that's why some of these difficult decisions, unfortunately, continue to have to be made. And, when I was talking earlier on about the power of autonomous decision making, this is it. We can take decisions that we think are right for Scotland, because matching England in the pace of exit from lockdown may well mean matching England in a higher number of infections and deaths as well. And I don't think many people in Scotland would want us necessarily to do that. Katrine Bussey from PA.
Good afternoon, First Minister. With just one death from coronavirus in the last 15 days in Scotland, do you think there are lessons that the UK government could learn from the approach that has been taken up here? And are you disappointed then that the Prime Minister has not found any time to meet you to discuss this and to see how this could benefit the UK moving forward? And also, because I'm aware this is about coronavirus, just a quick question on the CETEL outbreak. You mentioned yesterday a number of establishments where the authorities had been in contact because there was a concern the virus could have been passed on. Are there any more establishments that have been identified, or is that still at the 5 you listed yesterday?
On the first part of your question, look, I'm not going to take too much more of the time of this briefing talking about Boris Johnson, except to say, do I think there are things that the UK government could learn from Scotland? Yes, I do. An approach that's very much driven by the objective of elimination, I think, is one thing that they could learn. And I've said before, I would encourage the UK government to do that, because I think that would help all of the countries of the UK to drive the infection to the lowest possible level, put us in the strongest position going into winter, and also minimise the risk of us going backwards again if the virus runs out of control again. And, if Boris Johnson wants to stop in Edinburgh on his way back down the road today, I'm not sure he'll be travelling in a way that makes that possible. But if he wants to stop in Edinburgh this afternoon for a discussion about these things, I will make time to meet him. So, the offer is always open. But, just as I think there are things that others can learn from Scotland, I think there's a lot Scotland can learn from others. There are countries across Europe and the world that I think that we have tried to learn from already. Scotland, for geographic and other reasons of location and such like, Scotland is not New Zealand. But I've looked very closely at the approach taken in New Zealand and tried to learn from that. I've looked at other countries and tried to learn from the good things that I think are happening, because none of us have all the answers here, and any of us who try to pretend we've got it all sussed and we've got nothing to learn, I think are risking letting down the people we serve. So, we'll continue to try to do the best and to learn lessons where we can get them. On CTEL, the 5 locations that I named yesterday, and named them in a very positive way because they've all been very cooperative and doing the right thing, are the 5 locations at the moment that we thought there were any risk of transmission around. But this is potentially still a moving picture. There is still contact tracing going on. There are still new contacts being identified and traced, so it is possible that there will be other locations identified, and that it may not be the case that other locations that are identified are thought to be significant enough in the risk matrix to name, but if that is the case, then obviously we would add anything at the appropriate time. Chris Musson from The Sun.
Mr. Minister, as you said, huge borrowing has been required to support the economy. In the pandemic, with the 4.6 billion coming to Scotland, you also tweeted about independence this morning. So can I ask, how would an independent Scotland manage such crisis borrowing in its early years, perhaps its first decade, while not having its own currency, which of course is the plan of the SNP's Growth Commission? Because economists and indeed critics within your independence movement have said that without control of monetary policy or an effective central bank, your plan, the sterlingisation plan, could make borrowing more difficult or more expensive. So as well as explaining how we'd managed to secure this level of borrowing, can you tell us, does this crisis mean you could now rethink this Growth Commission policy?
I'll come on to the arguments about independence when we're focusing on the arguments about independence. I've got a pandemic to deal with right now, and that's what I'm going to focus on doing. But in short, just in a couple of sentences, maybe the way to answer the question of how would an independent Scotland cope with borrowing is to look at how independent Ireland already does it, or independent Denmark or New Zealand, or any of the other countries across the world that are having to borrow right now. Some of them bigger than Scotland, some of them smaller than Scotland, some of them the same size to Scotland. So maybe there's some lessons to be learned there as well. But I'm going to focus on the pandemic right now because I think that's what people across the country expect me to do. Tom Gordon from the Herald.
Well, Minister, they actually have their own currencies though, so that's not.
Look, Chris, I am doing a COVID briefing right now. There will be plenty of opportunities in the future for me to get into debates and answer questions about currency, about borrowing rates. That's not what this briefing is for, and I don't think it is what most of the people watching it want to hear. So I've said what I'm going to say. I've tried to answer your question to some extent. You'll get plenty of opportunities in the future to ask me and grill me and scrutinise me and all of these things. And when we get to that stage, I'll be delighted to engage with that. But right now, this is a briefing about COVID, and that's what I'm going to try to stick to.
But it's you who brought up both independence and borrowing today, so that's why I asked you the question.
And I tweeted earlier on in response to the Prime Minister's visit that is different to standing here in a Scottish Government building doing a briefing about COVID. And I'm making the obvious point that independent countries the world over borrow money, and an independent Scotland would be in no different position. What I'm saying to you is if you want to get into the guts and the detail and the intricacies of that, now is not the time for that. I'm more than happy to do that on future occasions. Tom Gordon from the Herald.
Hello there, First Minister. Can I take you back to the COVID forecasting service you mentioned in relation to shielders? Can you give us some idea why this is necessary given levels of infection do seem to be very low across the country? Has it been done with an eye to the winter months, perhaps? Also, what kind of scale would it be operating on? Would it be how COVID is doing in your local health board or your local authority area? And it sounds like information that would be appreciated and informative for everybody, not just shielders. Will it be made available to all?
So these are all very good questions. I'll go so far in answering them, but some of these we're still looking at just now. So we will set out in more detail exactly what the form of the information will be and how that will be communicated. It is designed so prevalence and the other indicators around the virus are low right now in every part of the country, but we've seen in Lanarkshire in the last few days that there can be outbreaks. So where there was a spike in any particular area, even if that is a very contained outbreak, we would want people to be aware of that. But yes, of course, it is also with an eye to what will hopefully not happen, but we cannot rule out going into the winter months where we have a general increase in community transmission, and we would want to give people the ability to be aware of that. We're talking about this at the moment with particular reference to shielded people, because people in the shielded category are at particular risk and I think have to be even more aware than the rest of us about the risks that they might face and the changing nature of those risks. But you're absolutely right that this is the kind of information that we will also want, as far as is reasonable and possible, to make available more generally to people. And we are looking at how we develop the information that is available in future in order to give people as much ability to make informed decisions about their risks as possible. Do you want to say more about that?
Absolutely, and there are a number of factors that will be taken into account there. That's why we're closely looking and monitoring care home staff and also with our hospital, any outbreaks we might have, so that we can put that overall pattern together and make the connections, because we know that when there's an increased community outbreak, then we have more outbreaks in hospitals and our care homes. And obviously, as our people who are more vulnerable, who we're calling our shielded group just now, then they too would want to be alert to that. And it's going to be very helpful, I think, for them to have a look at, but also for other areas as well, whether it's care homes or within the NHS, to know and have a sense of what's happening within their communities. And as you say, individual people as well may take an on-balance view, not to go into crowded places, or even less likely to go into crowded places if they know there are slightly more cases than there are just now.
Gina Davidson from the Scotsman.
Thank you. First Minister, 2 reports out this week, one from Engender and one from the Scottish Government, showing the financial impact of lockdown on families, children and young people. Many parents having to cut their hours or give up work completely because of their caring responsibilities. The government's new child supplement isn't due to be paid until Christmas this year, and I was wondering if you were considering bringing that forward to help low-income families earlier, and whether or not you would consider raising the threshold on who can qualify so more families are able to benefit from it.
Well, we want to do as much as possible, as quickly as possible. We have already invested a significant amount of resource into helping those most affected and those on low incomes. It's also one of the driving reasons we are so focused on getting children back to school, to help parents, I think mothers in particular, with childcare and enable them to work and not have some of the challenges they've faced in recent times. With the children's supplement, we inevitably, that's not just about paying money. We have to have the systems and the infrastructure in place to make those payments, and inevitably there has been an impact of that on the fact of having to deal with COVID. We are trying to minimise that, and we want to get that up and running as quickly as possible. And we will always look at eligibility for benefits and such like, but the decisions we took originally around eligibility were very carefully considered, and so too would any changes in the future. Derek Healy from the Courier.
Thank you, First Minister. The Office for Statistics Regulation said yesterday it had been unable to verify the Scottish Government's claim that COVID was 5 times less prevalent in Scotland than in England, because the data sources used to make the comparison are unclear. Queries have also been raised about the claim by the UK Statistics Authority and a former head of health analysis at the ONS. You have repeatedly referenced that 5 times comparison during your briefings. Do you stand by that comparison, and can you explain where those figures come from, please?
Yes, I do stand by it. It may have changed by now. You see the prevalence continue to go down in Scotland, but I stand by the comments I made. In terms of where they come from, these are figures about prevalence. They are, I think, UK government derived figures, so perhaps the question is more appropriately directed to them. My understanding of the comments that have been made by the statistics regulator is around not that they are wrong, but the source is not published, but they are UK government figures, as I understand. But there's published figures right now that you can look at in terms of new cases every day, the number of people dying, that will show you the same kind of relative position between Scotland and England. I hope that gap closes. I hope it closes because prevalence in England continues to fall and we keep it low in Scotland. I take no pleasure in that gap, which is why, as I said earlier on, I think if we all were working collectively towards an elimination strategy, then we perhaps could get some alignment around the suppression that thankfully at the moment we are seeing in Scotland, and which I hope continues in Scotland, and I hope we see England follow suit. Dan Sanderson from The Telegraph.
Thanks very much, First Minister. Just to follow up on an answer you gave yesterday on Ireland and their decision to exclude the UK from the green list for air bridges. Now, you said you wouldn't be critical of any other country that would exclude the UK or Scotland from their list. But do you think, given what you've said about the different prevalence rates, that there is a case for other countries to look at Scotland differently than the rest of the UK when deciding on air bridges? And is this something you would encourage them to do? Thank you.
Yeah, I think there is a case for that because prevalence rates are different in Scotland compared to England. But that's for other countries to decide. Interestingly, there are arguments made in the UK to treat other countries on a regional basis, not that Scotland is a region, but you get the point that I am making. When we didn't have Spain on the exempt list, there were arguments made to me that we should exempt the Spanish islands, even if we weren't exempting the mainland. So, and there are arguments being made right now about, having Madeira, even though we don't have Portugal or the Azores, and we don't have Portugal. So these arguments are being made generally right now, and I guess in principle they could apply to the UK, where if Scotland has a lower prevalence, then there might be different arrangements in place. But it's for me to take these decisions in terms of people coming to this country from other countries. It's not for me to second guess the decisions like the governments in Ireland or anywhere else take. So I think it's for them to look at the evidence just as we do and arrive at decisions they think are appropriate for them. Michael Blackley from the Daily Mail.
Thank you, First Minister. You've made clear yesterday and today that you don't anticipate encouraging people back to the office anytime soon, and you don't anticipate immediate changes to many of the lockdown restrictions. Do you, given the UK government, as you've acknowledged, is encouraging people back to the office, do you anticipate that economic growth in Scotland in the short term will be slower than the rest of the UK in the short term, such as this quarter, for instance?
I want to see growth return. I want to see growth return in the short, medium and long term, but I absolutely know that the way to make that most likely and most sustainable is to keep this virus under control, and that's what drives these decisions and will continue to drive these decisions. Simon?
Just briefly, if you look at the experience of the reductions in GDP of Scotland and the rest of the UK, there isn't much difference at all, in fact. And in terms of the timing, you'll look, it's a case of weeks. The differences in terms of economic experience in Scotland primarily is driven from a sectoral basis because of the issues, for example, affecting oil and gas, but also tourism is a far bigger impact, has a far bigger impact in Scotland. But on the other hand, you can see in England and also in Wales that the automobile, in terms of car manufacturing, will have a bigger impact in their figures. So everything is relative, but in terms of the experience to date over the last few months, they by and large have reflected each other.
And lastly today, we have Helen Puttock from The Times.
Hi. First of all, I wondered if you could clarify an answer to Tom Gordon's question whether this SMS forecasting service might be available to everybody, or if it's just specific groups. I wasn't 100% sure from your answer. The other thing I wanted to know was if you're able to tell us how social care assessments are working. Is access to social care assessments both for people in hospital and in the community back up to capacity, like it was at the beginning, or are we facing a situation of rising bed blocking again and people in the community not getting access to support for weeks on end?
Okay, I prefer not to use the phrase bed blocking because I think it's a bit pejorative, but I'll hand over to the Chief Nursing Officer on that point. On your first question, I don't have any more to add to my answer to Tom at this stage. We will have more to add as this work develops in coming days, but just to clarify, the point I think you were asking me is that at the moment I was talking about an SMS service to shielding people, but I, in response to Tom, accepted the point, because it's a point I agree with, that this kind of information has broader relevance, and we will want to give the general population as much information in the future as we can. But we'll say more about that over the course of the next days and weeks.
And our social work services have continued across Scotland. One of the benefits of having an integrated health and social care system is that there are already strong relationships between the health systems and the social work and social care systems. So anyone who goes into hospital who's had care at home, the restarting of that would be automatic and would be because of these good relationships we have across the health and social care system. Any new assessment that social workers are needed to carry out sometimes can be carried out remotely, depending on whether they already know the client, and our social workers have been working right through the pandemic. Some can work from home, some office-based, and clearly others who are needing to visit clients. Obviously, they support young people as well, but in this case, if we're talking about older people, they have been there to make assessments in partnership with the healthcare teams on admission to care home, moving back to home, and doing that as safely as we can. And we would see that and expect to see that continue.
Thank you. That concludes the questions for today. My thanks to both Fionas, Fiona Hyslop and Fiona McQueen, for joining me today. My thanks to Robert, our BSL interpreter, and as always to all of the journalists. Can I remind you before I go that as things stand at the moment, there is no scheduled briefing tomorrow, Friday or on Monday. We will go back to 5 days a week at the start of August. The only thing that would lead to a change in that is if there was something that we're not foreseeing at the moment that we really had to come here and brief you on either tomorrow or Monday. But as things stand right now, there will be no briefing tomorrow or on Monday, and I will be back here with you on Tuesday at 12:15, and I hope you can join us then. In the meantime, can I just impress upon you the importance of facts, face coverings, avoid crowded places, clean your hands and hard surfaces, 2 metres distancing, and self-isolate and book a test if you have any of the symptoms of COVID. And if we all stick to these 5 basic measures, then the progress that we're able to report here every day, I very much hope will continue in the days and weeks to come. But for now, thank you very much for joining us.